Amazing. I wanted to ask you one more question on the topic of mental health. What is your belief, or what's your opinion about the medication for it? So antidepressants, anxiety do you think they have value? Do you recommend it to your patients? Just want to cover this before
I'll give
we
you the
finish.
statistic.
Okay.
What you mentioned, we call the
SSRIs and all this.
drug acting on central nervous system.
Yeah.
In medical, we call it in that group. Drug acting on central nervous system is the most growth rate among all types of drugs.
Right.
You may think we use a lot of statin.
More than diabetes drugs and everything? More. The growth.
The big growth rate is the drug acting on central nervous system.
Wow.
Antidepressant,
Anti-anxiety,
sleeping pill,
Xanax.
Anti-anxiety, yeah. And the consumer, the biggest consumer is the younger people. The fast growing segment of consumer is the younger people.
Yeah.
Younger than 17 years old.
Starting them in high school already.
Yeah. So that is statistic. Consumption is coming up quickly. And your question, is it necessary?
Or your beliefs on the, yeah.
I myself, I practice yoga. I mean real yoga, not asana.
Right.
My teacher is an Indian yogi. And to be a yogi, you got to prohibit yourself from any kind of central acting.
No substances.
No substance at all, because it's kind of contrary to the practice.
To the beliefs.
So I myself do not use that kind of nervous system stimulant. Only thing that I use, despite my teacher tell me to stop, is coffee. And the reason I still drink coffee, because it's one among a few things that I can do it with my wife.
It gives you energy.
It give me a common thing with my wife.
Right, you have
with
a
my wife.
coffee together every day.
Yeah, in the morning we drink coffee together, have breakfast.
Yeah.
It's kind of a
routine, ritual.
But for all, so personally, I do not believe in the using medication that act on the nervous system. But this is not the view of the mainstream.
Why do
doctors.
you not support it? Because side effects, or because of dependency, or efficacy?
Because these medications, they do harm more than good.
Right.
Painkiller is another segment.
Another form.
The same group of this. It act on the central nervous system. The consumption of painkiller coming up quickly and beyond control, let's say. And those who are addicted to painkiller, among them are doctors. And among doctors who addict to the painkillers are anesthesiologists. They are the one who use it.
The prescribers are the users.
Yeah. They do harm more than good. That's why I do not support the idea of using this kind of drug. And I think we have to turn to start with training our kids, our children,
From a young
to
age.
be able to handle issue in life, handle stress, to be able to observe their own thoughts, to learn to meditation, to learn to live with each other. I just start the small small class in museum science not a few months ago. Young kids as 9 years old come as a group, 30 of them, and I teach meditation to them. And I learned that at that age, a few of them are prescribed a drug acting on central nervous system. Some prescribe antidepressant,
like
some
ADHD,
treat ADHD.
like Ritalin, those one, Adderall.
That is not the right thing,
Yeah,
the
very
kids
young
only
age.
that age. There's no point to give them medication. So I think we are heading to the wrong direction. But I predict here, I may die first, but you will be your generation will be able to see it. In the next few decades, this kind of drug will be the
number one sellers, more than
anything,
cholesterol
more than
lowering,
statin, more than whatever.
insulin, everything.
If we still not able to bring in what we call holistic
approach to stress
meditation,
management,
stress management. People, when we talk about, even among doctors, I used to propose the family medicine practice to bring in meditation as part of consultation. But it was rejected on ground that what you said, that it is difficult to do. People
like you said, it's only a few minutes a day. I think it's possible, but like obviously it's asking people to change their behavior, so it's a bit harder than giving them medicine, I guess.
Yes. It's a matter of coaching. That is the other thing.
Exactly.
Big deal.
They need to get training.
That is another big deal. Doctors are not learned to coach. We need a coaching system.
One more small. What's the link between your gut and stress? Because you hear a lot about this gut and mind connection. So is there a link between your?
All we know nowadays is that a lot of neurotransmitter, I mean the chemical that work. Usually, the electricity will be conducted from one nerve cell, and
the passing of information,
and jump into another nerve cell. Between the nerve cell, we need a chemical to carry the electrical signal.
Right.
We call neurotransmitter. And usually, neurotransmitter do work in the brain and in nervous system. And now we know that not only brain tissue that produce neurotransmitter, a lot of them produced by the gut bacteria. Now we know that. Particularly neurotransmitter that act as antidepressant. So we just learned recently that there is connection between type of gut bacteria and production of antidepressant.
Of these neurotransmitters that can be.
That is what we know nowadays. And there is some research document the relation between depression and type of food they eat. Because type of food they eat, bacteria also eat the food.
Exactly.
What we call prebiotic. So the plant-based diet, which is the food for bacteria as well. One study, I recall one study done in a group of patients called protracted depression, severe depression. They divide into two groups, ordinary diet in one group and plant-based diet in another group. And the plant-based diet group done better in terms of
reduction of depression. So definitely there is connection between neurotransmitter produced in the. Got it. Okay, that's the link between the brain and the gut. The neurotransmitters are made there. But in
management of stress, I would like to emphasize on observing thought.
Yeah.
I think that's the key.
Yeah.
If we are not able to observe our own thoughts, we will not be able to handle our stress,
Yeah.
regardless of what we eat.
Yeah. I was listening to just to close Sadhguru, you know, the Indian.
The Indian, yeah.
So he has a meditation and he just repeats the two lines. He says, "You are not the body. You are not your mind. You are not your body." And that's like breathe in, breathe out. So very similar to what you're teaching with the breathing and like stepping back away from your thoughts and just like
right. To remind ourselves verbally, I think that is kind of a good idea.
He verbally says it.
Yeah.
It's like a guide. Follow along on YouTube.
I think that's
listen
a good
to
idea.
it not often, but I should do it a lot more when I'm not feeling like
I think
so
it's a good idea. Very good idea. Remind ourselves verbally that
you're not your mind.
you are not your mind.
You're not your thoughts. You're not your body. Like you're just step back.
That's
like you said.
exactly the way to go. That is exactly the way to go for stress management.
Yeah.
Not drug, not medication, and even not food, I think.
Well, I found that very helpful. I mean, I'm sure everyone has their days where they feel like they could use some stress management. I guess we can close it there. And thank you everyone for listening, and we'll see you guys in the next episode. Once again, Dr. San, thank you so much for your
welcome.
time and
You're
your
welcome.
knowledge. Thank you.
Thank you. See you later.
guys.